Okay, so I am here in Mr. Carl Rogers' room. Need to call the doctor, so I'm going to do that now. Ring ring. Hi, my name is Sarah. I am the nurse here in room 148 taking care of Mr. Carl Rogers. He came in with a non-healing wound on his right heel and very high blood glucose readings. He has no previous illnesses besides the diabetes. He denies any injuries or traumas, and his past surgical history does show that he did have a transurethral prostate resection about 5 years ago. However, he is taking some medications that like lisinopril for blood sugar and a thiazide diuretic as well, which could indicate that he does have any other underlying issues that we don't know about yet. So with that being said, during my assessment, I did take his blood sugar, and that was slightly elevated, about 140 or 150. Also, going through some of my other assessments, everything was pretty normal. Assessing his wound, though, it does have some serine sanguineous drainage to it, and it's just not healing properly. He does state that he is having some pain. He does have a 3 out of 10 pain in his right heel. It's sharp, non-radiating. Pain meds do seem to make it feel better, and touching makes it worse. So before I do the dressing change, we would need to medicate him. Also going over some of his labs, looking at his A1C, it's very elevated at a 7.5, which does indicate that he does have some uncontrolled diabetes. And he is not adhering well to his diabetic regime. Also looking over his CBCs, we're a little low, which could indicate anemia or wound infection. His blood cell count was at 14,000, which is a little elevated, so I am concerned that the wound on his heel is getting a little infected. I do recommend maybe getting a wound consult to come in here and take a look at that and see if there's anything else that we could do to kind of get on top of his healing process and to kind of alleviate some of that pain. Also, I would recommend getting a culture and sensitivity on his wound as well, just to rule out any infection. So I'm going to repeat that back to you. So we are going to get a wound consult stat, and then we're also going to get a culture and sensitivity test on the wound just to rule out any infections. So I would write that down and document that I did call the doctor, and these are the new orders.